question. You founded saveface around 4-ish years ago now?
4 years ago, just over, yeah.
And you've seen it grow exponentially in that time and do some really good work and cause some changes, I know, in the industry because I've seen it firsthand.
Yes.
But you've also heard, unfortunately, a lot of horror stories, haven't you?
Yeah, and that's really escalated in the last couple of years. A, as we've become more popular, but I think B, as the sort of rise in social media and selfies have become more prevalent, and actually reality TV, actually the more younger women especially are seeking these treatments, and often they trivialise to the point where people think they're just an extension of getting their nails or their hair done, and they pay very little attention to the fact that these are medical procedures. They go to people who are not the most ethical, so there's no consultation in place often. They don't tell them what they're being injected with, they don't tell them there's any risks or side effects. They go in, they have the treatment, and actually the minute that something goes wrong, the communication just breaks down entirely. The practitioner refuses to see them, and that patient is left in isolation with nowhere to turn, in turmoil. And just last week we had somebody who'd had a non-surgical rhinoplasty, and she'd gone.
Tell me about that. So how was that done?
That was done in a beauty salon. The whole consultation, if I can call it that, lasted about 5 minutes. She basically gave her a form, said this is where I'll be injecting, sign the form, treatment done. What was
the actual procedure that was done?
Dermal fillers to correct some asymmetry in this patient's nose. And she had the treatment, there was some swelling, but she said that was to be expected. So a couple of days went by, the swelling got worse, very painful, there was some discoloration, reported it to the practitioner. The practitioner said, you know, if you're really concerned, go to your GP, I can't see you again. She went to the GP.
She said, I can't see you again?
Refused to see her point blank, just said, this is nothing to do with me, you know, it's nothing to do with the product, it's nothing to do with the injection, it's something that you've reacted to, so go and see your
It's
GP.
Your fault,
it's your fault, in other words. So this girl goes off and she sees her GP, and he misdiagnoses it because he doesn't practice in aesthetics, and prescribes her antibiotics. That went on for 2 weeks. The swelling got worse, the discoloration got worse, and eventually she contacted us, and it was quite clear that, you know, our clinical director reviewed the images and it seemed on the surface to be a vascular occlusion. Luckily, we connected her with somebody that could...
So just to be clear, so vascular occlusion would be where the filler is injected into a blood vessel, has blocked it.
Yes.
Blood flow to whichever area of the skin that vessel was supplying is cut off.
Yeah.
The skin dies. It's bad news.
Yeah, you know, potentially that skin could have been compromised, you know, and she would have been permanently disfigured. Luckily, we caught it just in time, and we connected her with somebody that broke down the filler, dissolved it for her. But it's just, and this is the modus operandi of these types of practitioners that you see on Instagram, you see offering cheap deals, you see offering competitions. They've got hundreds of thousands of followers, and I think people take that as a, you know, a certification that this person must be competent and safe. But actually, you know, just because somebody's good at social media doesn't mean that they're safe or effective to inject your face.
I think it's important to say that any practitioner, the most experienced practitioner in the world, can and will have complications from time to time, but I think what sets them apart from the rest is how they deal with those complications afterwards. Would you agree with that?
Absolutely, and I think that is the key. You know, these are medical treatments, and as a byproduct of that, complications, risks, side effects can arise, but it's actually being in a pair of hands that, you know, if that does happen, that person will bring you in straight away, look at you, diagnose the situation, and is competent to effectively treat and manage that for you, so that you don't have to spend weeks not knowing what's going on, in pain, worrying, is this going to be permanently scarring me? You want to know that the person treating you can manage those complications for you.
So saveface were able to help this lady put them in touch with someone who actually did the practitioner's job for them that they should have done in the first place.
Yes.
And that lady learnt a rather unfortunate lesson.
She learned a very valuable lesson.
How is she now?
She's okay. She's, you know, the nose has made a complete recovery. The skin has returned to normal, luckily for her. And, you know, her take home from the whole situation was that she'd, you know, never just have a treatment done willy-nilly. She would do her research and actually just use somebody off the register, because she'd know that that person could manage any complication that arose from the treatment.